And welcome back to Midday. Glad you're watching, everybody. Andrew Reinhardt, a medical technician from Wasatch Medical Clinic, back on the show to tell us about a breakthrough solution for erectile dysfunction. What is this new treatment, Andrew?
This is called acoustic wave therapy. FDA cleared and clinically proven to do one thing: increase blood flow, which is cool. If you think about a guy that has erectile dysfunction, what is he lacking? He's lacking blood flow. Typically been treated with a lot of medication, and the medication comes with side effects.
Well, and new technology small enough that you can actually bring it right into our studio and hold it up so you can see what this looks like. What is the procedure? What's the process?
This is basically placed on top of the skin. It's non-invasive, not surgical. It has kind of a ballistic movement. It fires into the tissue of this part of the body, increases the blood flow, regrows blood vessels, so kind of clears out the plumbing, so to speak. So it's natural function in the bedroom versus medication.
How many treatments do patients typically need?
Typically, they'll do a few over 2 to 3 weeks, and this surprises a lot of guys. They say, this is something I have to repeat every year or every month. No, you go through a few treatments and then you're done, which is cool.
What are patients saying?
Well, they love it. They come in hesitant and embarrassed and anxious to start. By the time they leave, and you think by mid-August, if you came in pretty immediately, by mid-August, you could be back to normal and not have to worry about this problem that's probably getting worse.
How tough is this to talk about? How do people bring up this conversation when it's even like you and I on TV? We're tiptoeing around some of the terminology.
Right. Well, it is. I think the conversation is opening up a little bit now, but guys struggle with it. I say it's so much worse to struggle for the rest of your life than to come in 2-3 weeks and get it taken care of.
All right, you mentioned medication earlier. Why is that not enough? Why is that not working?
Guys taking the pill probably know exactly what I'm talking about when I say you will have a hangover the next day. You'll have the headaches and the blurred vision. They have to pre-plan things. And another interesting thing is that if the pill is working for you now, you will be taking more of it and more as the years goes on. And the side effects will get worse.
And this is more of a permanent solution.
Yeah, this is more long-lasting. It's not something you have to repeat every year or every 5 years even. So you do it a few times and you're done.
All right, new location in St. George. You've expanded.
Yes, we're in Murray. We also just opened in St. George. So if you're in southern Utah and watching, we have a full-time clinic there as well.
I was in St. George last weekend and I thought, you know what? It's getting big.
Oh,
they need their own location there.
Yes.
I know you have a special offer for our viewers.
We do. So if you're sick of the pills, if you have ED, call us right now. We will do an assessment, an exam, blood flow ultrasound, which will check for blockages in the blood. That'll be totally free, and that's done by a medical doctor, by the way. About a $300 value. Call in now. There's no risk, no obligation, and no cost.
So that number's right there on your screen, everybody. 801-901-8000. That goes to Wasatch Medical Clinic, again in Murray and in St. George. Go to our website, and we will show you the link to all that information, abc4.com/midday. Thank you, Andrew.
Thank you.
Bri, over to you.
Well, thank you.